July Team Brief comes from the strange and unique world of medical records, and here I am at the department at Wigan Infirmary. Now later on I'm going to be meeting the departmental manager, Sheila Lowton, and one of the people who works here, Michael Gallia, and I'm going to be finding out several things about the department. For example, how many of the records do we actually store in total? And if you put all this racking end to end, how far would it stretch? Also, which member of staff has her poetry published in a children's book? The corporate objective for this month relates to information, and this is the big plan we've got this year to procure a new electronic information system covering A&E, patient records, GP referrals and everything else, so that we can eventually move to a paper-light system. Now, where we're up to at the moment is that we're in the procurement process, talking to various suppliers with a view to making a decision by October of this year, and then starting to pilot the new systems in January next year in gynecology and ophthalmology. The main measures of safety for the Trust, starting with infection, are no cases of MRSA in June, so our total for the year to date remains at 1. 4 cases of C. diff, taking our total for 14 for the year to date, none of MSSA and 1 of E. coli. Now, the latest mortality figure we have, which is for April, is a fantastic 81.5, and we also know that the year-to-date figure for last year was 96.9. Now, you can see here on the C. diff chart that we've actually added in most of July, and it looks as if we may go a whole month with no cases of C. diff, so that's a position that is recovering there. Here's the mortality chart now, and in the bottom right-hand corner you can see that fantastic latest monthly figure of 81.5. So if we look at the total harms now for the month of June, there were no never events, 5 serious infections, 5 pressure ulcers, 2 serious falls, no ventilator-acquired pneumonias, 1 central line infection, and that gives us a total of 13 serious harms compared to the previous month's 12. I now want to tell you about an interesting new collaboration that we're doing with Bridgewater, which is to introduce a new catheter passport. Now, the problem with catheters is that if they are kept in for too long, they can cause infections and other problems. So the purpose of this project is to keep a much closer track on the use of catheters. So every patient with a catheter from the 17th of July will have one of these catheter passports. Now on to our main measures under the heading of effective. And you can see from this chart here that our A&E department scores continue to improve, and we're now up to mid-table in Greater Manchester. For the year to date, we're heading towards 96% and continuing to improve, and I expect us to continue to climb that table. It's been a reasonable month for finance, and at the end of the first quarter of the year, we're pretty much where we expected to be. So we've got a deficit of £125,000, our income is about £1 million over budget, but our expenditure is also about £1 million over budget. We've spent about £5.5 million on capital already this year, but our overall financial risk rating is a satisfactory 3. Now to update you on the position on Healthier Together, and I'm sure that you've seen that the local newspapers continue to speculate quite incorrectly about threats to our A&E. The Healthier Together team have made it perfectly clear that all of the A&E departments in Greater Manchester will stay open, and that the issue that's being looked at really is acute surgery. Now, we have been collaborating, as you know, with Bolton, and we continue to have discussions with Bolton about acute surgery, about orthopaedics and IT. And meanwhile, the Healthier Together team want to go out to consultation in December or January of next year with options for the configuration of services. And we don't yet know what those options will be, but we hope that our future will be in a partnership with Bolton. From the service and site strategy, we are now making progress with the formal opening of the new Urology building, the Richmond unit, which was opened formally in July. We also start this month, August, on the works on the new cancer care unit and the new pathology essential services laboratory on the Wigan site. And on the IM&T front, there's going to be an open day event on Friday the 13th of September in the Education Centre to showcase everything we're doing on IM&T. And we're also continuing to evolve the big hand dictation system, which is now being extended to simplify cardiology dictation and will continue to roll out elsewhere. The big new way we measure caring is through the National Family and Friends Test, and the first results were publicised earlier on this month. This is where patients are asked when leaving the hospital, would you recommend this hospital to your friends and family? And that produces a score for each hospital. Now, I'm very pleased to say that we've done very well at getting these cards back, over 800 of them in the first quarter of the year, so that's a 14% return. And the results are very impressive too, because we've got the second most positive score in the whole of Greater Manchester, coming just behind the Christie. So well done to everybody, and please do remember to keep giving those cards out to patients who visit the hospital. Now, we've just launched something called the Helpline. Now, this is for patients or carers who have any concerns or issues on the wards. This is started at the beginning of August, and the details are on each ward, so please, if anybody wants to use it, they can contact the matrons 24 hours a day, 7 days a week. Congratulations to Louise Hayes, who is the Quality Manager in SSDU. She is our Employee of the Month. Now, SSDU have been working on a very exciting project with Unipart to improve the quality in the organisation, and Louise has been right at the forefront as Quality Manager. So this award really is in recognition of her absolute commitment to improving quality in the crucial area of decontamination. So congratulations to Louise. And to finish off with, 2 issues around the Trust. First of all, on Wednesday the 14th of August there's going to be a Neurological Study Day all day in the Education Centre. So for any staff that are involved with patients who have a neurological event, this will be a great learning day for you. And another plug for November's Recognising Excellence Awards event. This is one of the most exciting events of the year, and the theme this time is going to be 1920s. Now, to get your ticket to this award, you've got to put in an entry, so please do so by the 2nd of September. Please showcase the excellent work that you've got in your department, and hopefully I will see you at the event in November. And that's the end of this month's Team Brief. So here I am with the manager of the department, Sheila Lowton, who's been here for 19 years. And I'm also with Michael Gallier, who's actually worked here as a temp for over 2 years, but today is his first day as a substantive employee of the organisation. So Sheila, if I can start with you, what's the main function of the health records?
Our main function is to store, retrieve, provide case notes to any department at any time for the support of the patients. The vital information is held within the case notes and is supplied to the departments.
And what's new in health records?
For us, the latest thing is the listening in action. We've had all the staff involved across the 3 sites, and it's really raised their spirits. There's a lot of things come to light, giving us plenty to work on.
What are you most proud of in health records?
Without a shadow of a doubt, the staff. Without the staff, we're nowhere, and we're fortunate. They're a good team.
That's absolutely right. But tell me, what are the problems and pressures that you face in the department?
The biggest problem at the present stage is the storage. As you can see, we're quite full in most of the areas. Storage.
And finally, have you got any personal good news stories to tell?
Not personal good news stories. For the department as a whole, we're really pleased that the Trust is looking at alternative storage arrangements for us. There's things in the pipeline, and we're really hopeful it'll be the answer to our prayers.
Now then, Mike, if I can ask you, you see all these files here. How many of these have we actually got in the organisation?
There's about 1 million records altogether, and that's equivalent to something like 925,000 patients altogether.
And if you put all this racking end to end, how far would it stretch?
It's about 16 miles, which is 26.5 kilometres about.
Okay. And what's the name of the person in the department who's had some of her poetry published in a children's book, and what's the name of the book?
It's Shelley Sefton has published the book, and it's a bedtime poem for every day of the year.